have Dr. Kalpana Sarangi, who's going to be joining us. She's a little caught up, but she'll be joining very soon. I have just got word that she'll be joining in 5 minutes, but until then, welcome to Health Live at Seniors Today. As always, we start at 5 p.m. sharp, regardless of what happens. And so here we are. Um, I'm going to take this opportunity to talk to you about the latest issue of Seniors Today. Can I ask our producer to air the video? So, as it happens, this is the centenary celebrations of Mr. Raj Kapoor. So I'm going to go off the video so that you can see it in full. Yeah, thank you. Thank you. So this is where the new issue of Seniors Today is out, as I know, or it will be out any minute from now. And this is the video of the issue. So we have a very special article written by award-winning writer Deepa Gehlot, who writes for us regularly. So she has written it. And we have one of our columnists, Mr. Nagesh Alai, also who's written it. But apart from that, there's a series of articles that would be of interest to you. So all of it is available on the Seniors Today website. You can take a look at it. It's available free of cost. You don't have to pay anything for accessing it. And we are in our 6th year. And so this is, I think, issue number 66. And you can access all the issues of the website of Seniors Today without paying anything on our website. So do take this opportunity to access the articles. And so as always, whenever we've heard that doctor is going to be coming in the next 5 minutes, but I'm also keeping an eye on my mobile phone, my WhatsApp messages, just in case I get a message from her. But those of you here who would like to offer any suggestions of what we should be featuring on our health webinar, do let us know. We will have a break on the 28th, though we might have a sponsored session on the 28th. But otherwise, we have a session next week, and then again back on the 4th. So if you would like to say something, please raise your hands and I'll allow you to speak. Katie Dadanchi, welcome. We were missing you for a few weeks, or perhaps you were joining. Yeah, so Sharda ji, I will try and yeah, just give me a minute. Just give me a minute. So I'm going to ask Mr. Jamunathan to unmute himself and speak.
Thank you, sir. Thank you for giving me an opportunity.
Yes, sir.
You can also allow us to, show our face.
We've never done that, so it's okay.
Okay. Nice of you. Okay. See, one thing that you can think of is that, see, the duration of these programs. In fact, I also conduct some programs. I'm basically from Bangalore. I also conduct some programs on behalf of NIMHANS. You might have heard of NIMHANS. So
right. Yes, I'm aware.
You are aware that we conduct the programs on Mondays and every alternate Mondays in English and another alternate Mondays, in Kannada. So in fact, I am one of the volunteers with them and I coordinate these programs like you are doing here. Probably you are more professional than me. I am not that professional. So, but anyway, these programs can be for a minimum period of about 1 hour, say at least 50-55 minutes. See, this 30-35 minutes is perhaps too short.
I'm going to stop you at that. I agree with you. I totally agree with you. But, we also have a situation where we are conducting the session on a Saturday evening. And this is also the OPD time of a lot of doctors. And so hence, we have in discussion with a lot of doctors come to this time of doing it only at 5 o'clock and ending it by 5:45. It's just a question of 10-15 minutes. But if and when we feel that there are quite a few questions that have come in, or if the doctor's presentation has taken a lot of time, then we do extend it ourselves. Okay, we do take permission of the doctor, check whether she or he is free, and then do that. Yeah. Thank you. But once again, I will note your point, and perhaps on some other day we could look at doing some sessions which are slightly longer. Sharda ji, I'm going to ask you to unmute yourself.
Yes, sir.
Yeah.
Actually, I want to thank about all you are doing for health, bringing such a nice doctor and nice information, and it's really useful. I would like more about health program and what you are going to do for that.
Ma'am, we do conduct health webinars every Saturday, as you know, at 5 p.m. We just take a break on certain days like Diwali. We take a break for around the New Year's because and not because we want to take a holiday. We are working. Our Evergreen Club app is up, and there are events which are happening. The only reason why we do that is because we feel that people don't want to discuss health issues on happy days. So that's the reason why we do that. But otherwise, we take sessions every week. But this is a forum for anybody here to tell us what kind of subjects they want us to tackle. You may not want to say it here, but you can put it in the chat window as well. We'll be happy to take it up. Feroz, I think the topic.
Can I speak for one moment?
Just one second. Feroz, the topic over here is different. It's last time's doctor, which is there, Dr. Vijay Rao Kore. Just have a look at that.
Okay, sir.
Yeah. All right. Yeah, sorry. Go ahead, please.
Actually, what happens, the 30 minutes are very less, We would like to more information.
I know, but it's not 30 minutes. It's 40 to 45 minutes.
Still, it looks very less.
Yeah, I know, but
because the topics are so interesting, we can't able to leave that, and we want more information. You people are giving such a nice information. We don't want in 30 minutes.
Thank you for this. We will take a note of it. It's just that we need to look at what we do, and the doctor's availability as well. Yeah. Anybody else wants to say something? This is an opportunity for you to speak up. Yeah. Yes, Manjulika ji. Hello. Mr. Satyanarayan?
या सर नमस्कार सर।
नमस्कार, बोलिए
सर। वो डर्मेटोलॉजी के बारे में थोड़ा सा, वो जो मेरे
We are having a session today on
problem.
dermatology. We are having a session today on dermatology. So you
इसके
can,
इसके
Abhi.
जी
Abhi.
जी जी
Yeah, okay. Thank you. Mr. Satyanarayan?
Hello.
Yes, Mr. Satyanarayan.
Good evening. Good evening. I would like to just give a suggestion that something dietary type of this thing restriction limitation for the senior citizens. Okay, depending on the age factors, 60 and above, 70 or 80, 75 like that.
Yeah, right. No, thank you. We have done a few sessions, but you know, we will do again. We keep doing dietary issues on a regular basis, but you know, I don't think we can do something immediately, but we'll come to think, you know, we'll definitely do it in the near future. I am going to call Dr. The hospital. All right. Yeah. So this is what sometimes happens when, you know, we are doing it on a day when doctors are busy, and we've done 300 sessions so far, but some of these things happen once in a while, and unfortunate. How are you, Mr. Lax? I'm going to ask you to unmute yourself. Lakshmi Narayan ji. Mr. Lakshmi Narayan, how are you?
Good.
How are you, sir?
I'm good. I'm good. Because I had my earplugs, but that was some way, one way. So I could hear you, but you folks are unable to. Now I've removed it.
How have you been? And so, you know, you are one of our regulars on the health webinar sessions. At least you keep a track of what we are doing. Anything that you would like us to do in terms of a topic?
No, I'm actually not as regular, but because I catch up with the recording many times, I do miss the live ones.
Right.
No, I think you have been covering a whole lot of topics which are extremely relevant to folks like us who are 60, 70, nearing. I'm pushing 70 very soon. So I love it. And in fact, I feel this timing is right. 45 minutes is perfect, because beyond that, attention span also may not be the same. My personal opinion, but I have heard others say that it should be longer and it should be more interactive. More interactive will take a little more time, because I think the presentations that are being given by the doctors are really exemplary, because that covers every aspect of the issue that we are having on hand. And after that, many have questions which are very similar. And I think you do a great job of covering everything in the best possible manner. And if there are some loose ends, then people are also allowed to write their questions and keep it, and then they can be, responded to. So anything more than 45 minutes, 50 minutes, may be a little longer as far as I feel. The attention span will perhaps not be the same.
Yeah, so that's one. Of course, the biggest concern is, more than the attention span. The biggest concern is that it is the day for OPDs, and Saturday is a day when a lot of people are off, have their off, and so they like to meet their doctors on this day, and which is why they are, we also need to honor the time issues of doctors. And we've also felt that, that some doctors who are, there are some type of doctors who do get, like for instance, our dermatologist today. It's a Saturday, and people do look at meeting a dermatologist on on a day when they are off. Perhaps something is not as urgent as in any other issue. But thanks very much for joining us as always. And I'm going to ask Mr. Santosh Paliwal, who's also joined, to unmute himself and say whatever you have to say.
हाँ प्रदीप जी, आप मतलब बहुत ही अच्छा कंडक्ट कर रहे हैं। आई मीन बहुत ही अच्छी तरीके से होता है। और आई थिंक वही है कि जब कभी डॉक्टर्स का लंबा हो जाता है तब थोड़ा क्वेश्चन आंसर्स का थोड़ा कम होता है, अदरवाइज तो
या आई नो, बट हम लोग ऐसा देखते हैं कि जब डॉक्टर्स का प्रेजेंटेशन लंबा होता है, so most of the questions have already been answered by the doctor. Okay, when the doctor's presentation is long. So but however, having said that, we will speak to doctors. We will try and look at what is the best possible solution. There's a new year coming in, and we will look at what new things we can do in the coming year. The idea is not to stick to a certain formula, to keep evolving as we go along, but we will do that.
अभी मैं ये कहना चाहती, can we have a session on fatty liver?
Yeah, so we've had sessions on liver on if you go to the website, the Seniors Today website, seniorstoday.in/webinar, and you look at liver, you will get a few sessions which have been done. But I agree with you. I'm making a note of it. We've not done liver for a while now, so we will get. And fatty liver is an issue that concerns so many of us. So we will definitely look at liver in the coming months. In the coming months for sure.
These days I hear a lot. Many people are having this problem.
Right. I agree with you. We will definitely do something on fatty liver, and we have not done it for a while. The link is also there in the chat window. You can take a look at the link and go there. We've had a cover story in our Seniors Today magazine also on liver. So you can take a look at both and see what we can do. I am going to check about doctor. It's already 5:20. We've never had such a delay. Hmm. Firoz, just keep a tab when doctor comes in.
Yes, sir.
Because now in this new format, I'm not able to. She's not able to join for some reason. I'm really sorry. There is can we have a session on ophthalmology? Ophthalmology, yes. We have had a few sessions on ophthalmology, and um, yeah, just give us 2 minutes. She's finding it difficult to get someone last. Let her join. No, anybody else would like to speak about any topic of interest? We've had somebody talk about ophthalmology, which is something that we should, yes, have again. It's a topic that everybody likes to uh, uh, yes, ma'am, tell me.
आई आई एम स्पीकिंग इन हिंदी सर.
जी
ये
बोलिए.
जो काच बिंदु जो होता है ना,
हम्म.
तो उसका पूरा क्योर नहीं है क्या?
आई एम नॉट एबल टू. मैं आपका क्वेश्चन आंसर नहीं कर सकूंगा, लेकिन व्हेन वी हैव द राइट डॉक्टर वी कैन get a response to that. I'm sorry, I will not be able to respond to your question. Uh,
Okay, sir, it's all
yeah,
right.
yeah. I'm not a doctor, so uh, this is it's never happened to us in the past. Is there anybody else who's a doctor here? Dr. Saroj, are you a medical doctor?
Yes, I'm a retired gynecologist.
All right. So can we speak with you? Until we have Dr. Kalpana Sarangi coming in, because I really don't know what is happening. She's not able to connect for some reason, whereas
Yeah.
the hospital are able to connect. So if it's okay, we will speak with you. If you
Regarding dermatology?
Well, general health is good enough, that you can speak about. Would you like to put your camera on, or is it you wouldn't like to keep your camera on? Whatever is your.
No, it's okay. It's okay. Anyway.
Yeah. So, Feroz, can you ask her to put a camera? Can you get her to put?
Yes.
Yeah. We're just putting your camera on, and we wait for Dr. Kalpana Sarangi to.
Will you come back next time? No problem.
Yeah, but anyway, now that we have so many people who have joined in, just for their benefit, if you can just give a few tips on, from your vast experience. We're trying to put your video on. Yeah. These things happen. These things happen. You've been in this profession, and of course, these things happen in technology. Whereas we've had Dr. Sarangi joining us in the past, and she has done a very good session. But yeah, so some tips from you, Dr. Saroj, about where are you from, Doctor?
I'm from Mumbai.
And
at present I'm in Melbourne.
All right. So this must be fairly.
It's night time. It's 11:45 p.m. Yes.
So I'm sorry to get you to do this at a,
It's all right.
Yeah. If you can just give a few tips,
Any question, let me see if I can answer, because now I'm retired 11 years now.
Just 1 second. I'm told that Dr. Sarangi has joined. Is she? Are you here, Doctor? Dr. Kalpana Sarangi, are you here? I got a call from the hospital saying that she has joined, but I am not able to see her here. Sada. 1 second. iPhone 68. Yes, I can see. Yeah. I can see that. Okay, I'll just get it. All right, thanks. Firoz, iPhone 68. Can you just make that?
Checking, sir.
These things happen. You're on mute.
Oh my God, she was waiting.
I'm so sorry.
I'm okay.
I'm so sorry. I mean, we've been struggling to get into the meeting, but some glitch or the other was happening.
These
And
things
finally,
happen.
when I managed, they said that you are unmuted. They will not, the host is not allowing you.
No, so we will just rename you because we didn't realize that you've come in as iPhone 68, so which is why I spoke to the hospital. So I'm gonna just we do some calm down. Feroz, can you play the video first? Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us once again Dr. Kalpana Sarangi. She has been, as you would have seen on the montage earlier, she was our guest a few years back, and we've requested her to join us again. Before I request her to speak, I'm going to just introduce her. She is a senior consultant, one of the senior most dermatologists in the city of Mumbai, and she is at the Nanavati Max Super Speciality Hospital in Mumbai. She is a qualified MD in skin. She started as a dermatologist and subsequently established herself as the head of the cosmetology center at the Nanavati Hospital. She has over 3 decades of experience, and she is one of the few qualified skin specialists in the country, and to have established as herself as a cosmetic dermatologist. She has to her credit over 100 published articles in Indian and international journals, and also co-authored the textbook and atlas of dermato-surgery and cosmetology, manual of dermatology, surgery, etc. She is a recipient of 2 gold medals at the national level to her credit. And today we have requested her to speak about, we are in the month of December, and we thought it would be appropriate for her to speak about winter care and all that one needs to do in the winters. Over to you, Dr. Sarangi.
Hello, good evening, everybody. At the outset, I'd like to sincerely apologize for taking so much of time to come online. It's all technical glitch. And let us see. Last time I had done a presentation, and I think I got the feedback that they would like to have a one-to-one discussion. So I would speak a little bit now, and then we can have question answer sessions. We'll spend more time on the question answer session. So what is winter care? What happens in winter? All of us, irrespective from young to old or middle age, whatever, we experience certain type of changes in our skin. And what is that? First of all, there is the nip in the air becomes dry, the moisture in the air becomes less, there is less humidity. So because of the environmental dryness, what happens, the skin also loses a lot of water from the surface. So our skin, basically, which is the largest organ in the human body, it has 72% of water. And skin breathes, the body breathes through the skin, and we lose water through the skin. So in winter, what happens, because there is no moisture in the atmosphere, or there is no humidity in the environment, so we tend to lose more water. And secondly, why does it get more aggravated? Because in winter, we feel cold, there is no need of more, as the external environment is not hot, we don't have that urge to drink water. So our water intake or our fluid intake is much less. So what happens in the process? We drink less water and we lose more water. So in the process, what is happening is, and then because of there is a nip in the air, or there's the outside atmosphere a little cold, so our the external vessels, which are called capillaries, the tiny vessels, they go into contraction. So what happens is that you tend to feel little dry on the skin. You tend to feel itchy because of the dryness. And if you don't take care of it, then it can lead to certain dermatitis. So first I will speak of general care of the skin in winter. Then we will talk about what are the problems which you can face in winter. So general care is you have to hydrate yourself internally. That is, you have to drink a lot of water, you have to take fluids, and you have to have lots of fruits and salads, which you don't feel like eating in winter. But why fruits and salads? Because they're natural. They contain natural antioxidants, which is required for the health of your skin. That is number one. Number two is you have to moisturize yourself. How do you moisturize yourself? There are two methods. One is before you take your bath, especially I'm talking for the senior citizens, because the sweat glands, their oil producing glands, they go atrophy, meaning with age, what happens? The number of glands which we have, which produces oil naturally, it decreases. So we produce less oil for naturally for our body. So what you do is you have to externally hydrate it. So the best way to hydrate a skin of a senior citizen is apply some oil before your bath. Half an hour before your bath, you apply the oil. Let it get absorbed nicely into your skin and then take your shower. And after shower, what you do, before you wear your clothes, you apply a moisturizer, a thick moisturizer, which is, there are two types of moisturizer. One is a thin moisturizer, which is water in oil, and the other one, thicker one, is oil in water. So use the creamy type of moisturizer all over your body before you wear your clothes. This is number two. And the third thing, what you do is in prevention is before you go to bed, again, what you do with a wet towel, wipe yourself dry, especially your hands and feet and face, and then you apply moisturizer again. So this is the normal routine. This should be a routine for the daily skincare in winter. And the type of soap you should use is a glycerin-based soap or a moisture-based soap. Like you have a lot of soaps these days which are moisture-based or glycerin-based, so you can pick it up from the market. And some of them are also available in the pharmacy. You can pick it up from the pharmacy. Ask them for a moisture-based or moisturizing soap. They'll give it to you. Or you have a lot of body lotions which are moisturizing body baths. These days you have a type of body wash which contains oil in it. It is known as a shower oil. That is very good for the skin. You can use it for the skin. For your washing your face or taking bath, you can use that. So this is a general care. And besides that, drink a lot of water, have a decent amount of oil in your oil, meaning fatty food. Like, you can have avocado in the form of fruit. You can have avocado, which is very good natural source of fat for the body. And have a little bit of ghee. It's not bad for your health. These days, it is prescribed that we can have ghee without harming your cardiovascular system. You can have that. And whatever, sesame is very good. It has very good in iron and calcium, and also good in good fat and walnut. All these things you can have in your diet for a good skin, for good skin health. This is a prevention. And if you have, what are the skin conditions which you might have in winter? The most important thing is dryness of the skin, which is known as acquired ectasis or xerosis. Because of the dryness, lack of moisture in the skin, what happens there is the skin becomes itchy and dry. And then what you scratch, and when you scratch, it can get secondary infected. And when you have secondary infection, then it can lead to what is known as fungal infection. So sometimes in the groins, under the breast, in your armpits, or anywhere else in the body, you might land up with having fungal infection. So you have to take care of that. So for that, obviously, you have to come to a doctor. That is number one. Number two, most importantly, is you get cracks and fissures on the feet. Very many people, you see they'll get cracks on the feet, which is very annoying, and it is not only disturbing, but sometimes it can get painful also. So you have to take care of your feet. Care of the feet and hands is very important for our senior citizens. And every day before going to bed, one good advice I would like to give you is wash your feet and hand. And of course, you have to do for the face also. But feet and hand is something which we sometimes neglect. So you wash your hand and feet and apply good thick moisturizer before you go to bed. And if you have very deep cuts or very deep fissures in your feet and it's hurting you, so before you apply the moisturizing cream, you can apply some antibiotic ointment into the cracks and then use the moisturizing cream and wear a socks on top of it. So this is care of your hand and feet. And not only the skin, your hair also becomes dry in winter. Dry and frizzy it becomes in winter. And you have a tendency of getting dandruff. But what is dandruff? Dandruff is actually scaling from the scalp. Like how we scale from the skin, it is scale from the scalp also. So there are two types of dandruff. One is a dry dandruff, which you see, it falls like powdery the flakes on your shirt or on your body. It falls, that is known as dry dandruff. And there is a wet or waxy type of dandruff, which is sticky and it doesn't fall. It doesn't fall like, like a powder. So you have to take care of a dandruff, because dandruff not only gives hair fall, but it also causes very bad itching and it causes discomfort. So how will you take care of your dandruff? If it is in a subclinical state, you can oil it and frequently wash your hair. Normally in winter, what happens, we feel cold, and elderly people, they feel more cold. So they don't wash they wash their hair once in a week. That is not done. You have to wash your hair at least twice, or best if you have dandruff, wash it thrice in a week. So for that, what you have to do is you have to apply an oil overnight, and next day morning, you wash it with an anti-dandruff shampoo. So if you do it thrice in a week, then you can get rid of your dandruff. So that is one. One is your dryness of the skin or xerosis. Two is your fungal infection, for which you have to visit a doctor. Three is your dandruff. And four is, if you don't take care of all these things, you might land up with secondary infection of your cracked feet, of your fungal infection. Even the scalp also can also play up badly, and you can get a secondary infection. So these are the common winter problems which you have on the skin. And now I'm open for questions. We can have a discussion.
Right. Thank you very much. I know, but it was short and fairly complete. I have a question. You mentioned about thin cream and thick cream. I have got a question. And normally we do not advise or request doctors for brand names, etc. But given the fact that there are so much available in the market, and there's so many medicines which and made by companies which are fairly reputed, would you recommend a thick cream that one should perhaps put?
See, the thick cream is like, the common differentiation is the things which comes in a bottle. When it is moisturizing lotion, that is the thin cream. That is the water in oil in water. That means there is more of water and less of oil. So that is the moisturizing lotion. Any product where there is cream written, like, for example, I can give you a broad brand, like a CeraVe or Cetaphil, where there's a cream written on it, it is more thicker.
Okay, yeah. So that's a question which I was asked, whether Cetaphil is a good moisturizing cream to get. And what about the normal cold creams that are there, which are available? Is that something that you would recommend?
See, there are cold creams which are available for years together. People have been using it. So there are two different things. One is the cosmetic and cosmeceuticals. Cosmetic is something which has lesser medicinal property. So they are mostly have emollients. So it will be sitting on the surface of your skin and it will not penetrate into your skin. But cosmeceuticals have additives in it and the active ingredients, so that it penetrates into the skin and gives you long-lasting results. So as a doctor, I would advise you to use the cosmeceutical rather than a cosmetic.
Right. There is a few questions that have been come. One is from Shamla Ravi. What can be done for varicosity and discoloration of skin?
Varicose veins, like, if it is very bad, then you have to meet a surgeon. But if it is not so bad, then you have to do certain exercises, which is improving your calf muscles and then raising your legs when you're sleeping. You can put your legs on a pillow. And then what you do is, when you're using a moisturizer, but when you're using soap during a bath, you can use the milking action. That is, you push the blood away from the feet towards your knees. That if you do daily, on a daily basis, if you have very mild varicosity, it can be taken care of. And there are stockings also which help with varicose veins. But if it is more than that, then you have to meet a surgeon.
Right. A question from Mr. P. Satyanarayan. What could be the cause and remedies for continuous dampness on internal joints, irrespective of wiping intermittently during the winter?
Internal joints?
Internal joints, yes. Continuous dampness.
It could be, some people, they sweat a lot from the folds. So you have to use a silicone-based powder. Like, like I can name it like a powder called Absorb powder. You can use it to prevent that stickiness and that sweatiness, and use pure cotton undergarments.
Right. We have a question from Sheila Kohli, who asks, what can we use for fungal infection at home?
See, people use vinegar water for fungal infection, but I wouldn't advise that. I think you should meet a dermatologist for your fungal infection. Only thing I can say is we can use a ketoconazole soap to prevent fungal infection. But if it is beyond that and it is bad, then you should meet a doctor.
Right. We have Dr. Saroj Basa, who's actually from who's right now in Melbourne. We asked her to, you know, fill in when you couldn't join. So she is joining us at somewhere late in the night from Melbourne. Her question is: should we use moisturizer with SF?
SPF. Yeah, it's advisable. It is always advisable to use either a moisturizer with SPF or in these days, most of the sunscreen, they're very well advanced. In India, we have a lot of good products which is available. And it comes in a moisture. There are three categories, in fact, of sunscreens. One is the dry sunscreen, which is for oily skin. Then there is one which is for combination skin. And there is a creamy moisturizing sunscreen for mature skin. So if you have a mature skin or if you have a dry skin, you should use a creamy moisturizing sunscreen.
Right. A question on pigmentation on the face. I know it's not winter related, but or is it winter related? I'm not very sure.
No, winter related in the sense what happens, people, because of it's cold, they don't use sunscreen and then they prefer to go out in the sun. So the pigmentation increases. So you have to use a sunscreen. If you have pigmentation, the thumb rule is you have to use sunscreen every 4 hours. You cannot step out without a sunscreen. And we think that pigmentation increases the sun, like UV radiation, not only because of the sun. Your screen, your cooking gas, your telephone, your TV, all of them, they emit UV radiation, which can increase your pigmentation. Even the LED lights which are sitting under. So you should, whether at home or you're going out, if you have pigmentation issues, you should use a sunscreen.
Right. Is Rani Shekhar asks, is baby cream good for our skin?
Baby cream. See, baby cream, like people like to believe that baby cream is very safe and then it's good for the skin. It is good as an emollient, but it will not have any actives to work on a mature skin. So it will just act as nice protection and all that, but not like, you'll not get like some great results with it. But for a moisturizing a feel-good factor, it's good.
Right. We have a question from Aruti Ghosh who asks, should steroid cream be used in fungal infection like eczema? And then another question that has come in, is eczema fungal infection? This is from KV Lax. Recently saw a clip that instantly cures it by using camphor milk and a piece of banana. Mix well and apply in the impacted areas. In a couple of minutes, the skin peels off and it gets cleared.
See, steroid cream, like if it is given by the doctor, you can use, but use judiciously. In fact, we are running a campaign in India, no steroid in the creams. So steroid, what will happen is it will give you immediate result, but then there's always the flare back. When you stop the steroid, there will be a flare back and you should definitely not use steroid, self-medicate yourself with steroid. And secondly, about this camphor and banana, which you told, it sounds like a corrosive. So it's basically peeling the skin, meaning the skin is coming out. It is having a acid-like effect on the skin. So it is something which can be dangerous also. So you should avoid it. Like, some people use toothpaste on the pimples.
Right. There's a question which is, please suggest some collagen cream or lotion. Is that something that you would like to comment on?
See, I cannot take brand names on this forum, but yeah, there are a lot of cosmeceuticals, in fact, which has come with collagen cream. But you must see if the collagen is less than 5,000 Daltons, then it doesn't penetrate the skin. So it has to be a very good brand called collagen cream for you to take it.
Right.
So
this is a question from G Vijayalakshmi. What is the best external application for eczema or a psoriatic patch?
Psoriatic patch. Okay, so best thing is you have to apply emollient and then salicylic acid you can use. And if you're going to a doctor, under your doctor's prescription, you can use steroid for a short time. And there is some calciferol also is given for psoriatic patch, which is non-steroidal. And there's a new medicine which is in the market, which is very, very effective. It is known as tofacitinib. The ointment of tofacitinib is very, very effective.
Right. Doctor, this is a question that I got on SMS, which says, is it all right to do a teleconsult for skin, or is it always good to have go and meet a doctor physically because I'm not in a big city?
You can do teleconsultation, but I sometimes, for 2 teleconsultation, I'd rather see the patient after the third time. It's for skin, it's always better to show the person in person. But if you can't, then we can do teleconsultation.
Right. And this is a question from Shada Parvare, who asks, in winter, skin gets dry and feels like scratching. After scratching, blood comes out. What should be done for that?
Like I told first, before you take your bath, you use some oil, massage yourself nicely, wait for half an hour, then take your bath. Don't use too much of hot water, but that itself strips your body of the natural oil. And immediately after bath, use a nice thick moisturizer before you wear your clothes, and repeat that same thing in the night also. Night, if you don't want to take a bath, just wipe yourself with a wet towel or a hand cloth, and then apply the moisturizer again.
Right. This is another question, which is, I feel itchy in a particular portion of one leg. If I put aloe vera gel, is it okay? Or what else can I apply?
You can put aloe vera, it's suiting you. Otherwise, use the moisturizer.
Right. Doctor, there's another question which has come in. There are quite a few Ayurvedic ointments that are there in the market. Which one would you suggest for? Are these better than the ones which are available with chemicals?
See, I personally feel that, allopathic medicine is a known devil. So at least whatever is written, you know what is written. In Ayurvedic, you don't know what is written. Unless it's tried and tested, I suggest you don't go for it.
All right. And, this is a question which everybody asks. Which oil, coconut oil, olive oil, what should one apply for the hair, for the body, etc.? Which one, what would you suggest?
Unscented coconut oil is the best. And if you want, olive oil is a little thicker, but our Indian skin, we are very particular that we should not get tan, because when you use olive oil, the skin gets a little tanned. So if you're okay with it, then you can use olive oil. Otherwise, a good old coconut oil is very good. Cold pressed coconut oil is the best.
Cold pressed is what you would recommend?
Cold pressed. It's a natural form. It is not refined.
Right. Great, doctor. Thank you very much. You've, although you got a little late, but you answered, most of our questions. There are a few. What is safe to lighten the skin? This is not a winter question, but still, what is safe to lighten the skin?
Okay, see, don't go for steroids for lightening your skin, nor do you go for hydroquinone. Make sure that these 2 products are not there in your tube. There are a lot of other products available like vitamin C, arbutin, niacinamide, kojic acid, licoride. You check out tubes which has all these things, and they're all plant extract. You can use it for your skin.
Sorry, I got the question wrong. What is safe to tighten the skin, not lighten?
Tighten the skin, safe to tighten. Retinol is good, collagen is good. Oral collagen, if you take, that also tightens the skin. And you can do certain treatments also for tightening of skin. Like, energy-based device like lasers, HIFU.
Great.
And you can do facial exercises also, which is very good. Facial yoga. If you go to YouTube and you check out some facial yoga, they are really good exercises, which really does tighten your skin.
Doctor, what if somebody has a kidney issue and is required to contain the liquid intake? What would you recommend for them in the case of?
No, they have to cut down on their liquid intake. So the only way they can hydrate the skin is by applying little, like wiping themselves with a wet towel or wet muslin cloth and applying moisturizer again and again. Because orally they can't take too much of fluid.
Right. There is a question which has come in. Please type the name of the cream suggested earlier, which is new in the market. Would you want to?
Tofacitinib is the brand. The composition I'm saying, tofacitinib, TOFACITINIB, tofacitinib.
Great. Thank you very much, doctor. What about the kind of pollution levels that exist? You are in a city like Mumbai, where even there the AQI levels have been going up considerably. Our friends in Delhi and various other places are facing a lot of problems with air quality. Plus, there is the winter. Is there any general overall view that you would like to give for skin care?
See, like I told you, environment is the biggest villain in the whole game. Environment meaning I'm talking of internal and external environment. Like, 5 things I always tell people: hydrate yourself both internally, externally, have a good balanced diet, holistic lifestyle, do some form of exercise. Like when there's so much of pollution outside, you can do your yoga or pranayam at home. Breathing exercises are very good for the skin. And sleep well. 7 to 8 hours of sleep is very important. And take some supplements, like, you can take an evening primrose oil, check your vitamin D3 and B12, and take a multivitamin which has zinc in it. So these all help in the skin health.
Great. Thank you very much, Dr. Kalpana Sarangi, for joining us today. The session was short, but very good. And, you answered almost all the questions that have been raised. Thank you once again. We would come to you again in a different season. And, thank you to the Nanavati Hospital also for facilitating this. And to all of you here, we will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. Do remember that the new issue of Seniors Today magazine is available on the Seniors Today website. You've seen it's a Raj Kapoor special that we have, and there are a host of great articles that are there. There's an article by Mr. Harsh Goenka, which is also there. You must have a look at it and enjoy the rest of the week. And thank you once again to Dr. Sarangi. Thank you.
Thank you so much. And once again, sorry for joining in late.